Let me ask you, as a visionary, are you looking elsewhere in the medical field saying, hey, I could do a lot there too? Are you
I
seeing any
absolutely
other
am.
devices, therapies that kind of pique your interest?
Yes, ozone generators have piqued my interest.
Okay.
The materials that they're utilizing are quite generic, and we have in our R&D right now one that we're testing. It's the internals are a little expensive because it's 14 karat gold, but it produces such a tremendous of concentration of O3 that I needed to get our testers in here because I don't want to test it on a live person yet. We need to run it through our evaluation and determine that this is I believe it's going to be the next generation of O3.
I got to connect you with Mika Lowe from Simply O3. He's a good
Oh
guy. He was on
yeah,
here
yeah.
before, and he's everything ozone. But
Oh,
I mean, I agree. Listen, there are certain areas that there is definitely always room for improvement. And it's not just one step. What
I
you're doing
agree.
with the PL 2020 is great. I'm sure in a few years you even have the new PL 3000. It's going to be the
Yes.
4000, the
Yeah.
10,000 soon.
Yeah.
Because
Yeah.
once you start and really put attention, I don't think anyone's done that to these types of therapies.
I don't think
Ozone
so
is
either.
ozone, hydrogen peroxide is hydrogen peroxide, this is that,
Yeah.
right? We
Yeah.
even things like hyperbaric chamber, I'm seeing people out of Europe saying you could tweak it to be normabaric, where you could stay in for longer without any negative side effects, and it's actually better.
Yes.
So people are now paying attention and saying, how can we apply technology even more so,
Yes.
learn more about it, and
Yeah.
then really get the efficacy up there. So,
Yes. And the other things that we're looking at is the LED lights. Okay. So when I did the evaluation for our particular lights, the UV lights that we're using, unfortunately, we had to go with the fluorescence. The LEDs have not had enough tests, but I'll mention something here. About 4 years ago, a friend of mine called me out of Colorado and asked me to come up and do some scientific evaluation on their medicinal marijuana plants. And they have an LED calibration that can calibrate the medicinal marijuana to generate the THC that will attack PTSD, or you can adjust it to attack pain in your knee or pain in your back. And I was very intrigued by this, and that's where I started focusing in on the calibration of the lights to our UV devices. Well, if it's doing it to the plant, why can't we do it to the human? I hate to put it in that manner, but if we can calibrate the lights to focus on efficiencies and maximize the results to that, and that's what we've done. So that calibration theory so when we look at the fluorescence versus the LEDs are great because they'll last 50,000 hours versus our lights will last 8 to 10,000 hours. And like I said, I'm not in it for the money. I'm in it for the efficacy. So the reason I didn't put the LEDs originally is, it would have been a little bit more and less maintenance, but will it have the same effect? And we didn't have the time to test that as of yet, Casper.
right.
So what I'm looking at is the LEDs. Can we take this LED light and fine tune it to a needle point and focus it in on that person? I know there's other devices out there that are similar. They have fiber optics with UV lights going through it. They inject into your vein, and as the blood's flowing, it's supposedly doing that. Now they're getting about 2% of what we're getting, but it's getting something. So my theory on the LEDs is that we can manufacture an LED pinpoint size, needle head size, and take that and focus that in on, let's say, particular tumors or inflammation areas, and insert that, and within seconds you should see relief. So we're working on that. And so there's a lot of different things on the LEDs. Can we put the LEDs under our PL series and have effectiveness? Well, we're testing that as well. I have an engineer here out of Raleigh that is the national, he's nationally known for bacterial, and he's been working with LED lights. And he has it to where he can focus it in on 1,000th of a centimeter. So he can actually take this light and point it. And if you had a bad cell, let's say, he can destroy it. And so that was the theory that I took and said, well, if you can do that, then why can't we utilize this LED light to focus in on let's say, bad tumor cells or inflammation, what's causing the inflammation, maybe diabetics, maybe, I don't know. But we are working on a lot of different things here that hopefully will become some automation in the medical facility soon.
Oh, that would be great because, being in the medical system or around it my whole life, I can't really say I was in it, but I was so close to it
you were
growing
in
up.
it. Your dad, you couldn't avoid it.
No,
Yeah.
no.
Bless your heart on
Some of
your
my
dad.
best friends as a kid traveling everywhere were doctors, grown doctors. So I've been around this system a long time, and being also an outsider, going into business, being the entrepreneur, I could say it needs a little shaking up. It needs a little disruption. And it needs that infusion of thinking differently, people that are visionary like yourself to say, hey, this is a great system, but we could do so much more even with it.
Yes, that's my intent, is to try to modernize it. And like I said, a lot of the clinics didn't want to use something that was working quite well. And the reason was the maintenance and the setup and the procedure itself. So if you take that and we have a minor training to make sure that the provider understands that it has to follow the procedure. If it doesn't, it's not going to work the same.
Yeah.
And so, the PL3000 will have that controls built in. It'll make it a lot easier. It'll be available. So actually, medical hospitals should be able to use this. One of my friends and a couple of guys are on our board. One's he was a pulmonologist and then he became a cardiologist and then went to Duke and got his MBA. And I said, Tom, when are you going to stop? He goes, I'm retiring. So after all of this, he's retiring. He's on our board. But when I showed him this device 3.5 years ago, he said, John, this needs to be in every hospital in the world. If you come in, what's the main thing that you look at in hospitals? And that's MRSA and sepsis and bacteria infections. This gets rid of it. And so this should be a standard routine, but telling the medical world that, Casper, of course, it's not bringing enough money in.